Good morning, Dental Speakers Bureau on Facebook. Thank you so much for joining us this morning. I'm Vanessa Emerson, founder of Dental Speakers Bureau, and I'm very excited to be here with Dr. Marwan Abourass. Thank you so much for joining us, Marwan.
Thank you. Good morning.
All the way around the world. I'm super excited about technology allowing us to be able to spend this time together.
Yes.
Let me share with our audience a little bit about Dr. Abourass. He brings nearly 50 years of teaching cutting-edge innovations in the field of endodontic education. He has made significant new concepts and methodology contributions to the field. Dr. Abourass is a strong advocate of quality dental practitioner education and has traveled the world in pursuit of that objective. And we thank you for that. Today, we're here to talk with Dr. Abourass about the Abourass Masterclass series on diagnostics for dental hygienists. Before we dive into what's covered in this course, Marwan, could you please tell us a little bit more about what's happening in the dental practitioner's life that this course would help them handle or resolve?
Okay, first of all, I thank you, Vanessa, for everything you're doing to the dental profession. You're doing a great job.
Thank you.
You really are, okay?
Thank you.
Now, I am an endodontist by training. I practiced endodontics for about 50 years. I'm also a prosthodontist. And before both, I am a dentist. That is very important.
Yeah.
And therefore, today, I'm not going to talk about endodontics. Today, I'm going to talk about an aspect of dentistry which is very neglected, sadly, and that is the dental hygienist education. Back in the 1960s, the solo practitioner, we also had the solo dental hygienist. Her work was limited, very limited, to prophylaxis, teeth cleaning, brushing, polishing, teaching, flossing, etc. But that was the 1960s. But dentistry changed significantly to team practice, group practice, dental teams. And if we look at those teams today, we find that the role of the dental hygienist is so not recognized. It is incredibly neglected. What I mean by that, the dental hygienist could be a great asset to the general practitioner. The dental profession has neglected the dental hygienist politically and clinically. If you look at medicine, we see the PA, the physician assistant. When you go to a physician, what do you see? Do you see the physician first? No. You see the PA taking your blood pressure, getting your temperature, getting everything ready for the physician, history, etc., preparing the patient for the doctor. And we're not doing that in dentistry. In dentistry today, we have so much technology, so much advances, but unfortunately, we're not utilizing that for the dental hygienist. My proposal, my interest as a practitioner of dentistry first, and the specialist second, the most important person in that team is the general practitioner. But he is not utilizing the full potential of dental hygienists in the profession of dentistry. And that is sad. It's very political. It's unacceptable. It doesn't serve the patient, doesn't serve the doctor, doesn't serve the hygienist. It does not serve the profession. Therefore, I changed my focus, my full energy the past 2 years to do something for better utilization of the dental hygienist. And that is the introducing of the digital dental diagnostics for the dental hygienist. I call it digital dental diagnostics protocol, in which we utilize the dental hygienist, a key person in the general practitioner office, for the specialist.
Thank you so much for sharing your passion. It's clear you're very passionate about this and feel really strongly about it. And I would say that I've heard others who also feel the same. And thank you so much for bringing this to a forefront, especially from a practitioner who and an educator who is so well known and respected. I really appreciate you being here to share this today, Dr. Abourass.
Thank you.
Tell us a little bit more about what you propose then. In the course that you're teaching, what do we learn?
Okay, so basically, when I realized in my international travel in California, in different states, and then I heard about the politics of dental hygiene diagnosis. Do you know that dental hygienists are not taught good diagnosis? And do you know dentistry it's all about diagnosis. If you do not do diagnosis, you cannot provide the proper treatment. And the dental hygienists today is private practitioners. They are program directors in prevention. They are educators. They're doing a lot of tasks. But if you look at their clinical education focuses only on periodontics and preventive dentistry. But dentistry, the core of dentistry depends on three things: endodontics, periodontics, and restorative dentistry. This is the core, this is the heart of dentistry. The other three clinical specialties, oral pathology, pedodontics, prosthodontics, and orthodontics, are really not core material for the everyday practice of the general practitioner. If you look at general practitioners globally, that's all they do, those three things. And if we look at the education of the dental hygienist, it doesn't match that. Dental hygienists are really good in periodontics. They're really good in prevention. And recently, in the 1980s, 90s, they've been focusing on international, on systemic relationship to the oral hygiene situation. So I start looking in the textbooks of dental hygiene. I start looking in the dental curriculum, the dental hygiene education curriculum in the United States and Canada online. I took the best references in dental hygiene, and I went back and looking for endodontics. I looked for the things that they encounter every day in practice. And I was absolutely dismayed. There's no information for dental hygienists on pulp biology, endodontic biology. If they look at an x-ray, good endo or bad endo, they cannot realize that. And you know, endo, perio, and resto is one unit. It's a continuum. So I looked real hard in these references, in the education, and I found there is a definite shortage. The shortage strictly is in diagnostics. What I mean by diagnostics? Diagnostics is the clinical diagnosis, that's what you look, what you see in the mouth, the radiographic diagnosis when you take an x-ray, and then your mind about the biology, what is normal, what is abnormal. If you put these things together, you'll come up with diagnostics of endo, diagnostics of perio or restorative dentistry. Dental hygienists focus only on perio. And the masterclass series, which I worked on the past couple of years, focuses on adding a new dimension, making dental hygienists more aware of endodontic problems, pain problems, resorption problems, good endo, bad endo, and the relationship between endodontics and periodontics and restorative dentistry. And that's why I basically work on it.
That's exciting. Like I'm getting excited. And I'm not a hygienist, but I'm listening to you and thinking how wonderful to be able to have a new resource available for those who are ready to accept that challenge and move forward with their career. Now,
you know, Vanessa, I just spoke to a very important political hygienist. She's been in practice for 9 years. You know, she told me, in the United States, she told me we're not allowed to speak about diagnosis. When dental hygienists doing the process of care, when they're looking at this patient, they have to identify the problem, they have to come up with a diagnosis, they have to make a treatment plan, implement it, check the outcome, present the information to the dentist. how could they practice dentistry? They are practicing full-fledged dentistry. And you can't just do that with the information they had received in their dental education. We are looking for the future. The vision of the future is to make the hygienist the source of collecting information, data, diagnostic data, getting it ready for the general practitioner. My goal is the general practitioners. There are 147,000 general practitioners in the USA. There's about 160,000 dental hygienists. 95% of them work in private practice. And we must put these things together because today we are doing team dentistry. We are team dentistry today. And the dental hygienist, with her past information, cannot function in this team. She must communicate. She must use the right terminology and better communication with the dentist, the specialist, and the other health professionals.
I love this, and I hear you. And what I would like to do is throw out an invitation as those who join us, come on this broadcast, to type in their questions that they might have for you around this topic. And I'm also going to encourage those who listen later to provide your thoughts in the comments, because I think this is an area where we're going to have a lot of commentary, where people will also be feeling very strongly. And so tell us a little bit more about, okay, we've talked about the problem. Tell us more about where can we go to get this solution? Is this a course you offer? Is this on an online course? And tell us more about how you help us with this.
Perfect. Basically, I prepared 6 units on advanced diagnostics. The first unit takes the traditional examination techniques we use in dentistry, endo or perio or resto, pulp testing, perio testing, etc., etc. And I looked at them from scientific standpoint, and I looked at the information they already have. The information in dental hygiene textbooks is antiquated. They talk about electric pulp tester, which we have not used. I have not used in the past 50 years, all my life. I teach pulp testing, electric pulp testing, as a historical instrument. They talk about heat tests, etc. So basically, I evaluated this information and proposed alternative based on evidence-based dentistry. The second unit, I introduced the 4R operational diagnosis system. I am teaching, I have written this specifically for the dental hygienist because I had it for the dentist before, for the general practitioner, how to diagnose. And that is using the patient report, the radiograph, the response testing, and then actually look. We look at what we call warning signs. When you look at the tooth and it's changing color, that means there's something bad inside that tooth. The color of the tooth is the mirror that reflects what's going inside the tooth. Could be a nerve is dying or the root canal is failing. So we call those warning signs. I have a whole unit on warning signs. Just looking. The dental hygienist does not have to operate. We are emphasizing diagnosis using the 5 senses of the clinician: listening, hearing, looking, touching, etc. This is why I call this a 4R operational diagnosis. Then I have a unit on pain, oral and dental pain, and the complexity of that issue. And we made it very simple. Do you know that when you have a problem in dental pain, the most important thing about it is a man named Weldon Bell, who basically said, when it comes to oral and dental pain, all pain should be looked at as a toothache until proven otherwise. What does that mean? That means we must have a good examination of the patient. So I have a unit on that. I have a unit on dental resorption. There's about 10 different types of root resorption where it occurs clinically in endodontic, in periodontics, and orthodontics. So we have a unit on that. So that's basically what it is. It's unit, it's online.
Yeah. I'm looking at it right here, actually. If I could just I'll just jump in. I've put underneath at the
Put
bottom
C,
here
put
a link.
CE MENA online, CE MENA online,
Oh, am I?
CEMENAonline.com.
Yes, and so I've given a link from your website that will take them to CE MENA online. And it looks like
Yes,
it looks like there's a special offer going right now, actually, a promotion that's right there at the top of the page. And you can see all six of those broken out,
yes,
those different courses.
yes.
Very, very reasonably fee, a very low price on the fee, by the way. Thank you for that. And we can also earn CE credit, obviously, with these. So that's just fabulous.
Yes, yes.
Yes.
And I could also, no, so, okay, Vanessa, these units right now, 1 hour, each one is about 1 hour, but it's basically written specifically for a dental hygienist who's going to be doing the diagnosis.
That's
So she
awesome.
could inform, she could recognize the problem, explain it to the patient, increase their awareness, and prepare the patient for the dentist. And then she carries that information to the dentist, the data. And the final decision is for the general practitioner. The final decision is for the dentist to change, modify, confirm this. So what's the value of that? The patient is winning,
Yeah.
getting good care, comprehensive care. Who's winning?
Well, the team too.
Everybody is winning. Everybody is winning in this aspect.
Oh,
Comprehensive diagnosis is essential. Okay.
I love it. So we're sold, Dr. Abourass. We're sold on this idea that this is I am sold on this is a great idea. So how do we get this out to the public? So we have one way. We have no, I don't mean the public. I mean dental professionals who might need this information. So we have the online CEs, but you also speak on this topic.
Yes. Now as I said, it's 6 units. That means it's a whole day.
Mm-hmm.
There's nothing like Vanessa. There's nothing like live presentation, physical.
Yeah.
Being physical is it's all about. So you could actually present this material in live presentation in all day, starting with what's good, what's bad, and end up with a full package of information from perhaps, it's an all day course. Okay.
Awesome.
You cannot do it in 1 hour or 2 hours or a 30 minutes interview. I have a lot of information and I like to share that. My target, to be honest with you, is the general practitioner and the practicing dental hygienist. They are the edge. This is what we need. We need to bring them together professionally, clinically, in every aspect. And the focus is digital, comprehensive dental diagnostics. That means
now, so it's a full day course. Are you able, if a meeting only has a couple of hours, are you able to modify to still be able to bring this at a higher level, to be able to give them a portion of this?
Of course. I mean, you could abstract it, you could summarize it, but the real information is to feel the interaction with the audience so they could have questions and answer these questions. Okay. Yeah.
And then another question for you would be, tell us a little bit more about the format. Is it all lecture? Is it fairly interactive? I mean, what would a day with you feel like?
It's basically, I do a lot of PowerPoint presentations. Okay. Pictures, X-rays. In Unit 5 of the masterclass series, I actually have about 300 X-rays. I interpreted about 300 clinical X-rays, which I shared with the patient.
Wow.
So basically, yes, it's the idea of being there, being alive, talking to your audience, explaining and responding to questions, etc. Yes, I do believe in the technology. You could make video clips and all of that. That's all also available in a short concept. But if you want to take the whole package, is something, and then you could focus on your specific interest. I call it single concept. That would be like 8 minutes, which I'm adding later to the masterclass series.
Awesome.
Now, the masterclass series, we have available an introduction, 8 to 10 minutes introduction. You could see it talks about the whole next hour. Okay, and then you also have the presentation itself, and you have an examination certified. If you pass the examination, then you get the credit or whatever. But it's all that information is available online.
Online, perfect. And I'll put one more time, I'll put that link up here. So if someone wants easy access to that, go to your website, which is Abourass, ABOURASS.com. And then there's a CE online tab, or you could just use the link that's right here.
Masterclass. We have it under Masterclass.
Yes, under Masterclass, and that will take you over to CE MENA Online. If you have specific questions or would like to reach out to Dr. Abourass to find out more about his online masterclass, or certainly bringing him to speak for your event or meeting, I'm putting the email up here, mar@abourass.com. Now, before we go, Dr. Abourass, is there anything that we haven't talked about that would be important for the meeting planner to know about working with you or working on this presentation? I know you have multiple endodontic courses for the general practitioner, but so tell us, is there anything that would be important we haven't talked about?
Vanessa, I'm looking forward for the meeting, the Jumpstart Program 2020 in Arizona.
Thank you.
I think it's a fantastic idea, okay? And I'm really looking forward to seeing you there. And I'm going to be presenting 10 minutes on the Masterclass series, okay?
Yeah.
10 minutes, it's going to be such a difficult time to do that. I love to talk, I like to explain, I cannot do anything. I just pronounce my name, Marwan Abourass. It takes 3 minutes.
Well, I'm really excited for that too. I'm glad you mentioned that, because for the meeting planner who would like to hear just a snippet from this presentation, we will be going live from Jumpstart, and right here on our Dental Speakers Bureau Facebook page, they'll be able to watch you present that 10 minutes, as well as 30 other colleagues on a wide range of topics. So that'll be January 9th through 11, right back here, and we'll be notifying and put up some more details about that. But is there anything specifically about working with you or about this topic that we haven't covered, or do we pretty much get it?
Yes.
Awesome. It's exciting.
Basically, it's a message. It's an ending message. You know, I've been in dental education about 50 years. I'm a prosthodontist. I am an endodontist. I got a doctorate in educational psychology and teaching. And I've seen dentistry up, and now I'm seeing it coming down in the area of diagnosis. Not only dental hygienists are not getting good education in diagnosis, but even our dentists are not getting it. And that is sad. Emphasizing on aesthetic dentistry is great. But the key issue is diagnosis. That's it all starts, and that's where it all ends. Identification of the problem, the appropriate treatment, and the prognosis. And that is really the message I like to give, not only for the dental hygienist, but for every person listening to this presentation. Thank you so much.
Oh, thank you so much for being here. I'm going to put up our website one more time. This has been just really valuable and packed full of information. Thank you. And Dr. Abourass is available. If you'd like to find out more about his speaking programs, you can visit dentalspeakersbureau.com. He's listed there. Or the easier way would be to go right to his website, shown here on the screen. Multiple topics, including this new topic. And if you need any help connecting, just reach out to us, info@dentalspeakersbureau.com. I'm Vanessa Emerson, excited to have been able to be with you. And Dr. Marwan Abourass, it's really, truly an honor to have the opportunity to work with you and to be able to help bring your passion forward on such an important topic. Thank you for sharing with us today.
Thank you, Vanessa. Thank you so much for what you're doing. Thank you.
You're welcome. Okay. Take good care, everyone. And Marwan, if you'll just hold on for me, and we'll go ahead and sign off now. Thank you, everyone, for being here. And until next time, be well.
Okay. This way.